Okay, gang, here is the basics on skin cancer. We want to discuss function assessment and documentation of skin, different types of skin cancer, signs and symptoms of skin cancer, talk about the ABCDE method of skin cancer assessment, talk about diagnosis, treatment, and methods to prevent development of skin cancer. So remember that while lung cancer is the leading cause of death as far as cancer-related deaths, that skin cancer is the most diagnosed type of cancer in the U.S. So remember, our functions of our skin it's an organ that protects us, helps with body temperature regulation. Our skin, our complexion can have a psychosocial effect. Whether we have acne or lots of pimples or blackheads or skin disorders. It has nerve endings and sensation, helps us with sensation and tactile things, helps produce vitamin C, plays a role in immunity, absorption, and elimination. So our skin assessment tools include our eyes, our hands, our ears. So that includes looking, palpating, touching, listening to our patients, taking a history, gathering data, Braden scale, and remember nutritional assessment tools, because skin is related to nutrition. So our key steps, again, are health history, inspection, palpation, full examination, and then documentation. It's very important to talk about, these are out of order, guys. I usually talk about pathophysiology first and risk factors. Sorry about that. We're just going to go ahead and proceed from here. So our health history components, we would take our name, age, of course, gender, medical history, family history, lifestyle history, and especially lifestyle history as it relates to skin cancer. Things that we want to know about is tanning, use of tanning beds, and do we use sunscreen or cover up skin with a hat, or in any time spent tanning on purpose out in the sun. Inspection, doing deliberate, purposeful observations in a systematic manner. And then our use of touch, eye examination, and then documentation. Some forms of examination that we can use. We can use some kind of a scale, like our Braden scale. Things that we want to pay attention to when we're looking at the skin is, obviously, we're going to move in a head to toe or uniform manner, but we also look at our general cleanliness and hygiene, color of the skin, texture of the skin, temperature, warm, cool. Is it wet, dry? Do they have sensation? Is there blood flow? Remember, that's our capillary refill. Location and size of any lesions. If there is a lesion present, we document what type of lesion, what color it is, the size, the distribution, grouping, location, and consistency of the lesion. Remember that we document exactly what is observed or palpated. Again, the appearance of the lesion, the texture of the lesion. Is it raised? Is it smooth? The temperature. Does the temperature vary, or general temperature of the skin? Skin turgor, color of the skin, pale, normal for ethnicity, gray, blue, whatever color we have. Any moisture? Is it dry, scaly, or is it cool, clammy? Sensation, any ulcerations in skin sensation. Vascularity, cap refill, and then lesions or rashes, documenting size, location, and distribution. So this is some examples of that. Skin is pink, warm, dry, and elastic. No petechiae, lesions or excoriation, multiple moles of small size and regular border and surface. Red, macular rash, generalized over the trunk and thighs. Semi-confluent lesions measured 1 to 2 centimeters, abrupt onset. Skin cancer is cancer anywhere in the layers of the skin here. Most common one that we think of is squamous cell. So that's down here in the top layer of the skin. And then the deeper layers of the skin, the epidermis, is where we have those, the epidermis is made of the squamous cells and basal cells. So we can have squamous cell carcinomas and basal cell carcinomas. That's primarily what we're talking about when we say skin cancer. We're talking about the epidermis, the upper layer of the skin there. So we can have squamous cell carcinoma, basal cell carcinomas, and melanomas. Melanomas are the begins in the pigment cells on the skin, and it occurs on the skin surface. And here's consideration between men and women. On men, found on the skin on the head, the neck, or between the shoulders and the hips, and women typically on the skin of the lower legs, between the shoulders and the hips. It's rare in people with dark skin who have hyperpigmentation already, but it can occur, and that's the melanomas. Remember, are cancer of pigment cells, squamous cell carcinoma, that's the upper layer of the epidermis, and basal cell carcinoma, the lower layer of the epidermis. Risk factors, sunlight. So we were talking about modifiable and non-modifiable risk factors. Modifiable risk factors are going to be these first three: tanning, direct sunlight or tanning booths, severe or blistering sunburns, like people that do not apply sunscreen and just let themselves burn or get their base tan, and then sunlight and UV radiation. Can't change a family history, can't change skin color that burns easily, but these are risk factors. So the paler the skin, the more likelihood of getting skin cancer, as well as certain medical conditions, history of radiation therapy, keratosis, and HPV. All of that can lead to skin cancer. Signs and symptoms are going to be primarily localized on top, and most people will notice these. Remember, our skin is part of our psychology, so any alterations in skin people tend to notice quickly, especially in areas that we can see or assess in the mirror. So may include an existing mole suddenly changing in shape, color, or size, or feel suddenly becoming raised when it wasn't before, the shape changing, the borders, the color of it changing from one color to another, or suddenly growing bigger, skin that's hard or lumpy, or a surface of the skin that oozes or bleeds easily, just does not heal. Remember that if it was normal skin, the skin cells have healing capabilities within them. The RNA floating around inside of the cytoplasm can repair it, but in a cancerous cell, that's not going to be the case. So there will not be skin regeneration in that area. The skin area can be itchy, tender, or painful. So this is the ABCDE method of recognizing skin cancer. Very important for you to remember. We look at A, asymmetry. B is for border irregularity. C is color. Has it changed in colors, or is there a mix of colors? Remember with that melanoma, it looked different. Is the diameter over 6 millimeters, so over 1/4 inch in diameter? And has there been an evolution in the mole size, shape, or color? Has it changed at all? So A, B, C, D, E. Asymmetry, border, color, diameter, evolution. Remember that. Biopsy types, we can do a shave biopsy. That's just like we're shaving off a little piece of the skin on top. A punch biopsy. I think we already talked about that. Oh no, that was with my first year. Sorry. Punch biopsy, if you've ever seen, what's her name? Dr. Pimple Popper. She does punch biopsies, and it's just what it sounds like. It's a little sharp circular instrument that's the edges are very sharp, and it's punched right into the skin to remove a piece of the skin. You should definitely watch that on YouTube. Watch a punch biopsy. Incisional is not using this circular tool, but instead, again, making an incision and taking a piece or a chunk out of it. Can do core biopsies depending on how big the lesion is, or excisional to completely remove the lesion. Lab work of the blood primarily, because the dermis lies right beneath it, and can show up in the blood. Also, alterations of or evidence of metastases, and that's what all the other scans are for, basically. Is all to see if it is metastasized. But basically, your primary ones are going to be your biopsy, remember that. Staging is going to be based on the size, how deeply embedded it is in the layer, and whether or not it has metastasized. So what do we want to teach our patients to do? Limit sun exposure, no artificial tanning, stay out of the sun during the hottest part of the day. In Texas, that's 10 a.m. to 3 p.m. generally. Or no, is it later than that in Texas? I'm pretty sure it's 10 a.m. It starts earlier in Texas, depending on where you live. Wear long sleeves and long pants. Keep all skin covered. Wear a hat with a wide brim. Sunscreen, at least SPF 30. And then regularly check your skin for changes in moles. I personally have one laying on the back of my neck, and that's something that I have to keep an eye on regularly to make sure. Do my ABCDE skin assessment. Do that on myself, on my mole, all the time. I look for asymmetry, border, color, diameter, and evolution on my mole. So that's what we want to teach our patients about skin cancer. And that is it.